Hey guys, and welcome to A Policeman's Life, and I'm Kenny. So this is the 1 month video for my kind of rehab series for my Achilles tendon rupture surgery. So if you're just coming across this video right now, there's a few before this. So I looked at surgery prep, after the surgery, the first week, the second week, and now this is the first month. So if you want to see those videos, some of them will pop up here. You can just go back and look at my playlist. If you enjoy these, you can like and subscribe them. But this is the 1 month video. Currently, as we sit today, I think 4 days past 1 month. So I just wanted to give you a little update of how that went. So the last video touched on the first 2 weeks. So this would be kind of like 2 weeks to a month realistically, but just to kind of sum it all up, head surgery, the first week is you're very inactive, not doing much. You can check that video for all the details of that. Week 2, you're starting to feel more yourself. You're getting around on your crutches, you're starting to get off your heavy pain meds, your appetite's coming back, and then at the end of week 2 you start at physio. So, and I had a little video of my first physio appointment, and if I'm looking down, I have some notes on my phone there. So at the end of week 2 you start physio, and it's very basic. So at first, the physio gentleman or lady just basically kind of like massages your foot, because there's still a lot of swelling in that. Massages the foot and then starts to move it and stretch the Achilles. So you're in your boot and your foot's kind of like at that angle. So here's your heel, your toes, your leg. So your foot's kind of kept in that with all the wedges in your boot. So what they start to do is bend it this way. You obviously don't get it to 90, so you get it bent back. So the first appointment is just bending your foot. They'll hook you up to, I guess it's called the TENS machine or the EMS machine, basically the pulsating machine that I think helps remove some swelling. And then after that, they'll hook you up to, what's the machine? It's another one that sends electricity. I forget the name of it, but they hook you up to that machine. Maybe it's the ultrasound. No. Anyway, they hook you up to another machine that sends electricity through the foot or the heel area, and they usually have it with ice. So that's like the first few appointments. Then after that, what they'll do is they can do. I started doing some exercises for my calf. Basically, you ball up a towel and they have that underneath your heel so you don't fully go down on the ground, and they hook up the TENS machine to your calf muscle, and every time that it sends the electric shock to your calf, you do a little bit of a calf raise as you're seated. You're not standing, and that's just to help to stimulate the calf muscle, because at this point what you'll notice is that the calf has shrunk quite a bit. It's kind of sad. I'll throw a little video in right here about my calf, but whatever, it'll come back. So as mentioned, here's the video about my calf size. So I'll switch this around. So here's my, oh, there's Evie. Say hi, Evie. Hi. So here's,
I'll eat those.
Okay, I'll eat those. Just spicy pepperoni. So there's my calf. You can see a little difference there. But it's definitely really kind of thinned out, lost. And it's funny, like the muscle gets quite, I guess what you call almost like jelly-like. But anyway, that's the calf. Okay, so you saw what the calf looks like. So now just to talk about the wound. So after, I guess probably like the 3rd week to like the month period, the wound has really healed up quite a bit now, and I'll just show a video that shows what my wound looks like there. Okay, so I'll try to show you the wound here the best I can. So there you can see it. It's healed. Is it focusing? Focus. So you can see a little bit of bruising still here. The cut went all the way up to here, so the scab is gone. It's nicely healed. There's a little bit of scabbing right there, but but overall, I'd say it healed up pretty nicely. It's hard to get it focused there. Okay, so you saw the wound, it's healed up really nicely at the month mark. So we've done a little bit of physio, some calf raises. You're also able to do some exercise during the first month. Basically, they don't want anything that will engage your calves, like you're not pushing off anything. So you can do, like I did all, like it was upper body stuff. So I can do some push-ups, arm curls, some shoulder stuff. I have an air assault bike, and I sat on it and I just did the arms to activate. So it's good to move, but you're gonna, and then they'll give you some exercises too, actually, like for you to engage your hips and your glutes, because you're not walking on it, so they go a little bit dormant. So you'll get some exercises. Obviously, don't do anything unless your surgeon, your physio tells you it's okay to do. Every surgeon, every physio will be a little different depending on what protocol you follow, so you want to follow that closely. So, and that's basically what the guideline is. So just looking at my protocol, I have it here. So the 2 to 4 weeks, so basically at week 2 to 3, I was allowed to put 25% weight with my crutches, and then on my foot with the boot, I was able to put 25% weight on that. So then the next week that moved up to 50. Now week 4 to 5, which I'm in now, I'm allowed 75%. And at week 5, which will be like 3 days or whatever, I'll be allowed 100% weight on that boot. So that's going to be exciting. So I'll get rid of the crutches and I can walk on that boot. So also during this time, they say control swelling with ice, maybe acupuncture, light laser therapy. You can do some calf stimulation stuff as tolerated. So the big thing here is going through this, you have to make sure that you listen to your body. So if you're doing something and it really starts to pain or swell or anything like that, cut it out and go back a step and work your way back up there. You don't want to aggravate anything too much. Patients begin seeing a physio 2 to 3 times a week, depending on availability, degree of pain, and swelling. I'm going 3 times a week, Monday, Wednesday, Friday. That works good for me. I can see how you could do it 2 days a week if you really needed to, like based on coverage. Realistically, you could do it 1 time if you have the right equipment at home, like your own TENS machine. The physio could give you basically a plan for the week, but that's based on coverage. So if you're covered 100%, go the 3 times a week. It's definitely a lot easier to be under their guidance, the extra. So knee and hip exercises with no ankle involvement, i.e. leg lifts from seating, prone or lying down, non-weight bearing fitness, i.e. cardio biking with 1 leg with the walker boot on so you don't hurt it. Deep water running, usually not started till the 3 to 4 week. I haven't tried that. So basically it's saying you could go in the water and run because obviously the weight's off the joint. Now it doesn't say there, excuse me, fly there. It doesn't say there if you do the deep water running with the boot on, because that would get it wet, but I'd be a little timid not having the boot on and putting too much weight on. So anyway, check with your physio if you're doing that. Emphasis, this is what I mentioned before, the need of the patient to emphasize the need of the patient to use pain as a guideline. If pain is present, back off and lower weight bearing. So basically that's what I said. Use pain as your guide. That's the biggest thing. You know, everybody's different. We have these guidelines that are given to us by surgeons, and a lot of them will be all the same from surgeon to surgeon. But definitely you are different. So if you're feeling pain and it says you should be able to do something at this period and you can't, well, maybe you're going a little slower in your recovery. So just bear that in mind. So definitely the second half of the month is very positive. You definitely will have some emotional days. That's something to be like, maybe when you really notice how much your calf has shrunk. that kind of bummed me out for a day, but then you get over that and you think, okay, that's something I'm going to work towards, build back. And you have your ups and your downs through this. Maybe I'll do another video about the emotions of recovery, but definitely the second half is where you kind of start to see progress. Like, okay, I'm doing exercises, I'm doing movement, I'm getting a lot more flexion in it, so that's really a positive thing. And then going forward, so my week 5 and 6 are kind of will be exciting, where I can ditch the crutches, and I can do 100% weight bearing on the boot. I'll still be in my wedges, so I'm not going to be flat-footed, so it'll be awkward to get around, but that's something to look forward to. So thanks for stopping in. I'll have some more update videos on how the recovery of my Achilles rupture surgery is going. Check out some other videos if you want, and we'll chat with you later.